Hello, my dear friends. I once again welcome you to this session on Corona and COVID. In last session, I tried to explain what are the variants. Now today, the Delta variant has become more prominent, more talked about, more dangerous. From all the sections concerned with the Corona and COVID, they are warning the people against the Delta variant. So in this session, I try to explain some of the aspects, some of the details of the Delta variant. The entire humanity is shivering to hear the very word of Corona COVID. It is learning to live with it, albeit enforcing all the weaponry at its disposal to defend against the coronavirus, that is SARS-CoV-2. Some success has been achieved, but it is appearing with new devastating forms like our mythological demons or tsunamis. The world has successfully managed to deal with the alpha, beta, gamma variants, but at the cost of significant loss of precious human life. Now it is the turn of Delta variant that is threatening the world. It is the most formidable version of the coronavirus that causes COVID-19 among all the variants of the coronavirus. This is deadly, this is more dangerous. The predictions of all the health organizations like World Health Organization, CDC, Center for Disease Prevention and Control, that are monitoring the progress of the disease predict that this variant will be more dangerous and devastating than the earlier variants. Microbiologist Sharon Peacock calls it the fittest and fastest variant yet. Evidences are also pouring in that it is capable of infecting fully vaccinated people. Even the vaccinated people are not spared at a greater rate than previous versions. In this talk, I try to explain some of the facts about the Delta variant. Delta variant, or technically it belongs to beta lineage B-1-617-2. The variant of coronavirus was first identified in India in December 2020. Within a matter of months, this particular variant spread to 135 countries around the world. It became a dominant variant in more than a dozen countries, including India, Scotland, UK, Israel, China, and the United States, according to official sources. The Delta variant of SARS was behind the deadly second wave in our country that killed thousands and infected lakhs of people from March to May this year. Delta variant is now responsible for more than 83% of COVID-19 cases being reported in US. Among the Delta variants COVID patients, the Delta is responsible for more than 83%. Now, let us talk about some important aspects of the Delta variant. Number one, how contagious is the Delta variant with respect to transmissibility? How does it differ from the earlier variants? Data available in this regard suggest that delta is 40 to 60% more transmissible than the alpha and almost twice as transmissible as the original Wuhan strain of SARS virus. A Chinese study reported that viral loads in Delta infections were approximately 1,000 times higher than those infections caused by other variants. So in the patients infected by the Delta variant, the viral load will be more, that is estimated to be 1,000 times more than the other variants. In other words, the Delta variant patients can transmit the disease at faster rate than the patients infected with other variants. Number 2, is the Delta variant more dangerous than the other variants? In the UK, Delta accounts for approximately 90% of the current COVID-19 cases. In America, it is 83%. In England, it is approximately 93%. According to some surveys conducted, symptoms of Delta tend to be a little different from other strains. Some comparisons have been made with regard to the symptoms produced by the alpha, beta variants and Delta variants. Fever, headache, sore throat, and running nose are common to the alpha and beta variants, while cough and loss smell are not reported in this case. Cough and the loss of smell. Some other symptoms of serious nature include hearing impairment, severe gastrointestinal issues, and blood clots leading to tissue death and gangrene. A study conducted in Scotland reports that hospital admissions are more with respect to Delta variant. Similar reports are available from USA that were confirmed by CDC. Further, it confirmed that the majority of the hospitalizations and COVID-19 associated deaths in US are occurring in unvaccinated people. This point we must remember. The occurrence of the Delta variant is more in unvaccinated people. This underlines the importance of the vaccination. In this connection, CDC Director Dr. Rochelle Walensky warns that this is becoming a pandemic of the unvaccinated. It is more severe, more intensive among the people who are not vaccinated. So vaccine is very, very important. Third, will presently used vaccines remain protective against the Delta variant? What is the efficiency of the vaccines that are being used today throughout the world? Different vaccines are used. And what is their effective against the Delta variant? Neutralization levels of vaccinated sera are lower against the Delta variant compared to the original strain, nullifying the effect of the antigens of the coronavirus, neutralizing effect. A study was conducted on individuals who had recovered from corona infection and sera from individuals who had been fully vaccinated with the Moderna, Pfizer vaccines against infectious Delta virus. The results were published in the New England Journal of Medicine. Data from that study indicates that on an average, the Delta variant was 2.9 times less susceptible to neutralization than the Wuhan strain, 2.9 times less than the original strain. Hence, the researchers concluded that immunity conferred by the mRNA vaccines is likely to be retained against the Delta variant. There are some vaccines based upon the mRNA, they seem to be more effective against the Delta variant than the other type of vaccines. Similar type of results were obtained in another study which were published in the prestigious journal The Nature. This study evaluated the sensitivity of the infectious Delta against monoclonal antibodies, convalescent sera, and sera developed after vaccination. Still, another study conducted in UK reported that 88% efficiency against Delta after 2 doses of mRNA. mRNA seems to be more effective, and if that people take 2 doses, it gives the protection up to the level of 88%, but only 30.7 efficacy after first dose. So one should take the full 2 doses, which is below the US Food and Drug Administration, so that is 50% efficiency threshold for COVID-19 vaccines. A vaccine, if it has to be effective, it should give at least 50% efficacy. That is the standard laid by the FDA of USA. Putting the data that is available for us, it emphasizes, underlines the importance of full dose vaccination against SARS-CoV-2. But reports of reduced vaccine efficiency against Delta. Whatever the vaccines that are being used, administered today, they are less efficient against the Delta virus. And this points out another fact that booster doses are needed to increase the efficacy of the whatever the vaccines being used today. Genomic analysis of isolates from 63 vaccine breakthrough infections. Breakthrough infections means even after taking the vaccines, people got the infections. In India, but not yet published, revealed that this variant was the predominant lineage in groups who were partially and fully vaccinated either with AstraZeneca, that is Covishield, or Covaxin, being produced by Bharat Biotech in collaboration with Indian Council of Medical Research. Further research into breakthrough infections. Breakthrough means again the infection after the full dose of the vaccination that occur after mRNA vaccination is needed. Against this background, whatever the studies indicate, researches and observations, then the statistics tell us the reduced efficacy of the vaccines. So this is there is the reduced efficacy of the vaccine against the Delta variant. So therefore, the companies have already started developing booster doses to improve the efficacy against the circulating variants. Pfizer plans to seek FDA authorization for its booster dose, which is expected to elicit stronger neutralization against Delta variant. So on the whole, mRNA vaccines seem to be effective, and still what is needed is some booster doses to enhance the efficacy. How does this Delta